On the program tonight, the Prime Minister announces more financial aid for the regions and industries hard hit by COVID-19. On a day when Quebec and Ontario both set records for new cases and when the Ontario Premier announces new measures to curb the spread. And on a day when the U.S. President tests positive for the coronavirus. And that's where we start tonight. Prime Minister Trudeau today commented on the positive test for President Donald Trump and the First Lady. Here's what he had to say, followed by comments from the President's Chief of Staff in Washington.
My first thoughts are in support of them, and I hope for a speedy recovery. They had certainly reached out when Sophie got her diagnosis earlier in the spring. But let's not forget that yesterday, thousands of Canadians received a positive diagnosis of COVID-19. People are challenged with this every single day across our country, and our responsibility as a government is to do everything we can to support them and to arrest the spread of COVID-19, and that will continue to be our priority.
The President and the First Lady tested positive for COVID-19. They remain in good spirits. The President does have mild symptoms, and as we look to try to make sure that not only his health and safety and welfare is good, we continue to look at that for all of the American people.
Now, back in Ottawa, Prime Minister Trudeau was also asked about the record increases in new cases in Ontario and Quebec and what the federal government could do to help the record-breaking backlogs and what health officials are calling the breakdown of testing in Ontario.
We've said from the very, very beginning that testing is going to be key to getting this pandemic under control. That's why from the spring, we worked with the provinces on increasing testing capacity, on delivering equipment and reagent and supports needed to scale up the testing. As a key part of the Safe Restart initiative, we transferred $19 billion to the provinces, including significant amounts so that they can scale up testing right across the country. In many parts of the country, testing is well under control, but in places where the virus is hitting harder these past weeks, we've seen challenges with testing amounts. We're going to continue to work with the provinces to ensure that they have the capacity to meet the needs to get this virus under control.
Well, to look at the week in federal politics, and obviously another week which is dominated, where dominating everything else was Canada's response to the coronavirus. I'm joined now by three MPs from the different parties. Arif Virani is a Liberal MP for the Toronto riding of Parkdale-High Park. He's also Parliamentary Secretary to the Prime Minister. Alex Ruff is the Conservative MP for the Ontario riding of Bruce Grey, Owen Sound, and his party's Deputy Whip. And Rachel Blaney is the NDP Whip and the MP for BC, the BC riding of North Island, Powell River. All three of you, thanks for joining us.
Thank you.
Thanks for having us.
I want to start, obviously every week we know what dominates the discussion, and this week the pandemic is hitting, and in two provinces we have premiers and health authorities calling it now the second wave. And Rachel Blaney, where you are in BC and Alberta, I think the provinces there are more or less admitting that we're into the second wave. I want to talk about something that came up really big this week, and that was testing. We just heard from the Ontario government. They are now 90,000 cases behind in a backlog. They are now taking appointment-only testing. There are categories of people who are being told not to test, and some people are saying that that's challenging the actual validity of tracing if you're asymptomatic. There are problems. Arif Virani, what more can the federal government be doing to help out the provinces, two of whom are at least having real problems?
So it's a fair comment, and obviously we are sympathetic in hearing the frustration of Canadians that are in lines for tests right around the country. And what we're doing is responding as comprehensively as possible. You know that we put together a Safe Restart agreement. $4 billion out of the $19 billion for that was dedicated towards contact tracing and testing. You also should know, and your viewers should know, that we've doubled the capacity of staffers at Health Canada who are doing the approvals of rapid testing. But what we will do and what we will continue to do is make sure that it is not politicians or elected officials that make the final call on the best test, the most appropriate test, the most accurate test, but leave that in the hands of scientists and experts in the field. That is the expertise we've relied on since the start of the pandemic, and that's the expertise we will continue to rely upon. Has that caused some frustration? Yes, it has. We're aware of that, but I think this week we had some good steps with not only procuring 7.9 million tests that would be rapid tests from a source in the United States, but also ensuring that those tests have been approved as of about 2 days ago.
Now, one of the senior people from Health Canada told in several interviews on Thursday that the majority of those 7.9 million tests won't be available in Canada until early next year. Could anything more have been done faster?
I think there's always things that can be done quicker. I think what we're trying to do is this is very much a dynamic process, much like all of the income supports and business supports that we've rolled out over the past 4 or 6 months. Things can be sped up, and we're trying to speed them up as best as possible, at the same time maintaining that balance. And that balance is empowering Health Canada officials to make decisions rapidly and have the resources to make those decisions, but not making the decisions for them. That's a line that we won't cross, and I don't think Canadians expect us to cross that line, because that's when you jeopardize political considerations influencing what should be a science-based and medical-based decision. Okay,
Alex Ruff, your take on this, on where things are? I mean, obviously the provinces have a lot, in fact, the primary responsibility for things like testing and healthcare, but your take on this for the Conservatives?
Well, I'm very disappointed. I mean, you got the Premier of Manitoba coming out within the last hour saying that the federal government's blocking them from procuring those rapid tests that they've just approved. You've already noted the lead scientists that have said these tests aren't going to be available, the majority, until next year. So we need more rapid testing. And I don't disagree with the comment that it shouldn't be politicians making these approvals. But when we have scientists and we have agreements with other countries around the world and our allies, in particular the European Union, our agreement allows to take their scientists and health officials at word for those approved tests. After 6 months, I come from a military background. We need actions, we need decisions, and we need to move rapidly here. This is having a crucial impact, crippling our economy, the recovery. Our parents are being stuck at home, trying to wait test results for their children as schools are back up, as we absolutely need. And we need these rapid tests. Sole proprietors, small businesses, with this inability for them to get tested in hour wait times, it's just unacceptable.
Okay, Rachel Blaney, your take on this?
Well, there's no doubt. Canadians across this country are struggling profoundly. We knew that a second wave was coming. I think Canadians have been very clear. They want to see a process in place that is going to secure the best healthcare supports that there can be. We need to see rapid testing. I understand and agree that we shouldn't have politicians making these decisions. I'm certainly not a health professional, and I don't want to take that role. But it is also the government's job to provide the leadership and the resources required. Happy to see that there are more staff at Health Canada going through this process. Just wondering what the delay was. Nobody is surprised by the reality that we have a second wave. We knew it was coming. Preparing for that and making sure that the supports are there so that people are not having to deal with this on the fly is so important. And it is true. Across Canada, there are parents that are at home waiting for test results. They have small children waiting for test results. This is a scary time. We need to get those resources out the door as quickly as possible. And that is something that the federal government does have power over with the resources and how they choose.
Okay, Arif Virani, I want to shift now to the other side of the equation. That is obviously economic aid. And the federal government, everyone agrees, has announced a lot of aid. We had the CERB announcement. The CERB replacement legislation, C4, was passed this week. All three of you stayed up late to pass it. Congratulations. It just passed the Senate. And we also saw the announcement today of the Prime Minister, $600 million, topping up the $960 million in that regional development fund. But the big question still remains, Mr. Virani, the government and rent support, the compensation program for rent. Yeah. Rents are due this month. The program for more than 3.5, 4 weeks, the government's been saying we will replace it, we will announce a successor to it. And again, today we're hearing there will be an announcement eventually. A lot of small business people are waiting for when there will be an announcement of what kind of support for their second largest fixed expense, and that is rent, when that will come. Do you have any idea when it will come and what's the delay?
Well, what I can say to you is that you can take some cues from the throne speech, which talked about assisting small businesses. Some things were very overt and explicit, such as the wage subsidy and expanding the CEBA process.
Right.
But we also talked about assisting businesses with their fixed costs. One of their fixed costs, as you've accurately put it, is their rent. We are painfully aware of the situation. We are working very, very hard on rectifying the situation. There are some things that remain to be ironed out. Part of this just deals with the basic nature of the Federation and working with our provincial partners, but Minister Freeland is actively working on this. I cannot go into more details other than that, but other than to say that we are actively working on a rent assistance plan, which I'm hoping will also be more targeted and directed at the tenants who are faced with the rent consequences themselves and alleviate some of the burdens and obstacles we faced in the previous iteration of the rental supports.
Okay, I just want to read between the lines. You've said two things. If I read between the lines significantly, one, that the holdup is negotiating with the provinces, and two, that you want to heed the complaints by the sector that it should go to tenants and not to landlords, but that is also being, the rumor is that that's also being held up by the provinces. Can you shed any light on that?
Well, I'm trying to be as clear as I can with respect to you and your viewers, just to indicate that we understand there were obstacles with the previous iteration of the program. We understand the previous program is expiring. We are very keen to see that the small business supports that directly assist small businesses with their rents are delivered. But in order to do that, we need to have a level of cooperation from the provinces, and that's what Minister Freeland is working on very diligently as we speak. Okay,
Alex Ruff, how much of this should we be pressuring maybe provincial governments?
I don't think we should be pressuring the provincial governments. To me, the agreement, that's out there that unless something, a province has reneged or disagreed with sort of the current setup. Yep. The problem is that this rent assistance was a disaster right from the get-go. It's targeting the wrong people. It needs to be going the application process through the tenants, not to the landlords. So the landlords do get paid. It's failed 90% of small businesses. There's so many small business entrepreneurs that have not been able to access this. I can't speak for other MPs across the country, but I can't think of one email or phone call that I've got into my office saying, hey, this has been a great program, thank you for it, but I've got a ton of them that are saying, I can't even get to it. My landlord refuses to accept it. Doesn't want to apply for the program, so it's failing them hugely. And again, the biggest issue I have with any of these announcements, and even with the throne speech, I come, as I mentioned earlier, from a background, set deadlines, set timelines, put a plan on the table, because without that plan, Canadians they don't know what, it's all unknown. They don't know what to expect from the government. There's lots of promises, lots of platitudes, no action, and ultimately the best way to hold everybody to account is put a deadline on the table and then work towards it. If something happens that, ends up delaying things, that happens. That's life. But in the end, let's work harder and smarter and get this stuff done. It's time for action, not words.
Okay, Rachel Blaney, your last word on this, on the economic aid package, and maybe specifically on the rents.
Well, I'm happy to see some money coming. I know that this has been a big concern for my riding. Rural and remote communities really need the money sent to them. If we're going to have an economic recovery, we need to have our businesses still in our communities. I will express some concern that they're still not addressing the part of smaller businesses that have businesses run through personal accounts. That has still not been addressed, and that's a big gap. As far as the rental assistance, this program, again, has been very flawed. It needs to go to tenants. And I also think it's important that the government understand that there are small businesses that rent space who don't have a large amount of money waiting for them at home, who are going through the same struggle that every other business is going through. So the model really has to be focused on tenants so we get the results, and we don't blame those small businesses like some in my riding that are renting out space, doing their best to accommodate renters right now. That is a reality across this country. So focus it on the people who need it, the small businesses, the tenant. When is that actually going to happen? We're still waiting to see.
Arif Virani, I'm just going to ask you the last question, and it can be answered in a few words. We heard Mary Ng, the Minister for Small Businesses. We heard her quoted on this. We heard the Prime Minister quoted on this. We heard Chrystia Freeland quoted on this 3.5 weeks ago, saying any day now. Is there any idea of when this might be announced? As I said, we now are into the October rent period. But
What I can say to you is that we are supporting small businesses with every measure we can put together, and we are diligently working on this particular package with respect to rent assistance. You saw the regional relief recovery package of $600 million additional dollars going to businesses announced today. It's part and parcel of a broad suite of measures that we are using to address the critical needs of small business.
Okay, all three of you, I want to thank you very much. Thanks for taking the time, and good luck in your ridings, and good luck working on this as we all do. We all pull together. Thanks very much.
Thank you.
Thank you.
There was other news from the federal government today concerning the Canada-US border, which remains closed to all but essential traffic until at least October 21st. But today the federal government announced that Ottawa will now allow a wider group of family members to cross the border on compassionate grounds. In addition to parents, children, spouses, and common law partners, that will now be expanded to include long-term couples and grandchildren. And new rules will allow travel in cases such as caring for a sick relative, a death in the family, and end-of-life visits.
We will continue to monitor the situation very carefully, but I also want to reassure Canadians, until the conditions on both sides of the border, or as it pertains to international travel, change very substantively, until we can be assured, based on the advice that we receive from our public health officials and our evaluation of those conditions is such that we believe that those restrictions can be lifted safely, we'll keep them in place.
As we've been mentioning, today was yet another dramatic day for the provinces of Ontario and Quebec as the second wave of the coronavirus pandemic set in. Both provinces reported record single-day increases in the number of new cases. Ontario with 732 and Quebec with 1,052. And in Ontario, Premier Doug Ford announced a series of new restrictions, including on public gatherings and new province-wide mask regulations, and making testing around the province on appointment basis only.
We're in a second wave of COVID-19, and as Premier, it's my duty to protect the people. Throughout this pandemic, we have made some tough but necessary decisions, always based on the best medical advice and scientific evidence available. And after consulting with the Chief Medical Officer and the Public Health Measures Table, we will be bringing in more public health restrictions to try to stop this virus from spreading any further.
Okay, when we had the first wave, we closed everything. At that time, we didn't have the principle about keeping a distance of 2 meters. So that's new since last, I think, June or May. Second, at the time, we didn't have to wear mask when you're inside, for example, in a store or in public or collective transportation. So that's a different approach. So that's why I hope we won't need to close as many businesses as we had to do last spring.
Well, to look at yet another eventful and, truth be told, worrisome week as two of the country's most populous provinces plunged into the second wave of the coronavirus pandemic, and as BC and Alberta are following. To look at it all, I'm joined now by Robert Benzie. He's a political reporter for the Toronto Star, and he joins us from Toronto. Niigaan Sinclair is a professor, writer, and commentator. He's joining us from Winnipeg. And Marieke Walsh is a national political reporter for the Globe and Mail, and she's here in Ottawa. All three of you, thanks for taking the time.
Hey guys.
Listen, let's start with, because Robert, we've been watching in Toronto, there are a lot of announcements being made today by Premier Ford, obviously record numbers in Quebec and Ontario today, but Premier Ford was announcing a crackdown in certain measures and also regarding testing. But at the same time, a lot of the reporters' questions were whether he was going far enough. How would you evaluate what's happening in your neck of the woods?
I mean, the situation is really fluid, Martin. And at the end of the day, Ontario is facing a challenge in 3 areas: Ottawa, Toronto, and Peel Region in the suburbs of Toronto. The rest of the province is in fairly good shape. But today we had, more than 730 new cases. It's a record in one day. Now, part of that was because of some data collection issues that they've had. But it's also a worrying trend because they've said, if we get to 1,000 infections a day, then they're going to have to start shutting down more of the economy. Now, they don't want to do that yet, and that's why I think some people were saying to Premier Ford today that the measures he took including basically bringing the rest of the province up to the Toronto standard for masks. You have to wear a mask when you go anywhere inside that's a public place. Now you have to wear a mask if you're outside and you can't be socially distanced from people more than 2 meters apart. And on the testing, with a huge backlog of testing, 90,000 tests waiting to be processed, the government is now limiting tests in the sense that you have to make an appointment, and that will be one way to be a bit of a bottleneck. Now that's going to create its own set of problems, because if you think you have COVID-19 and then you're on hold for an hour and a half and you can't get an appointment for a month, what happens then? So the situation's moving very, very quickly. There's a lot of criticism, obviously, of the government at Queen's Park, as there should be, because we've had a lot of time to prepare for a second wave, and I think that there's concern that we haven't done enough or didn't do enough in the summer to get ready for this.
Okay, Marieke, I want to look at the federal level in Ottawa. When you look at what's happening in Ontario and Quebec, but also what's happening in other places, but Ontario and Quebec being the most acute, what's your sense and what's your evaluation of what's going on in terms of the federal level? I mean, there's so many different fronts, but weigh in on that.
Yeah, I think that the feds are in some ways trying to figure out how they can play a role in dealing with these issues that are so predominantly a provincial jurisdiction, a provincial matter of education and healthcare. And so what we're seeing, for example, is Ottawa today announcing more money to support businesses and to try and bolster the economy as the province trying to manage their healthcare fronts. The government's trying to, I think, backstop the economy, but there's still lots of questions around those programs. For example, there's been no replacement yet for that rent program for businesses that are struggling. And that, if we do see more closures or we do see limits to dining inside, all those things are going to hurt revenues even more. So I think there's a lot more for Ottawa to answer to on that front, but we've seen those moves today, and again, new changes on the border with who's allowed in and compassionate leave to allow more people in. So that's how Ottawa is responding. But I think for Canadians, for people watching our different levels of government respond, when you're seeing the local health officials kind of ring the alarm in a really serious way in Ottawa and Toronto today, and then having a much more muted response or reaction from the Premier and the federal level, it is kind of hard to process exactly what matters and who's doing what and why it's such a serious issue at the local level, but then the response seems much more low-key.
Niigaan Sinclair, in Manitoba, obviously there's not the acute crisis that the acute nature we're seeing in Ontario and Quebec, and to a certain extent in Alberta and BC. Give us a sense of Manitoba, though, what's happening and what the state of the pandemic is in Manitoba.
Well, for weeks, months actually, for the pandemic, Manitoba was relatively unscathed. We were at the similar amount of cases as New Brunswick, and much, of course, smaller geographical mass, much smaller population base. And then almost immediately, as soon as the openings, the lockdown was removed, openings began, public spaces were opened. Then we turned from one of the best cases in the country to one of the worst in terms of proportional. Proportionally, we've been leading for weeks now in the rest of the country in cases per day per proportional representation to population. And really seeing that is we're seeing that so in many ways, Manitoba is going through its first wave right now. Others may be going through their second, but we're right now in our first. Okay. And most interesting thing, too, is happening on First Nations. On First Nations in northern Manitoba, we're seeing a huge rise in cases involving Winnipeg, people who are coming to Winnipeg often for testing or visiting or groceries, which are as a necessity in First Nations communities, and then bringing that back to their community. Taskawayak, Pimichikamak, Peguis First Nation, they all showed cases in the past 10 days. And the problem, of course, when it enters into a First Nation, it's going to spread faster due to the lack of health resources, overcrowding in houses, the lack of adequate sanitation. It's going to go faster. And just like we saw during the 1919 Spanish flu, First Nations were hit months after everybody else, but it was way more devastating.
Well, I was going to ask you about that because, until now, when we watch federal briefings, for example, the Federal Indigenous Services Minister and all the deputy ministers have been saying until recently that things had been going relatively well in those isolated First Nations communities across the country. But you're saying that we're now seeing a worrying change in that.
It may have been in terms of active cases on around First Nations. But urban Indigenous communities have been seeing a high impact, particularly those in poverty situations. So those are the ones who are at the front lines, because we know geographically that COVID-19 impacts Black communities, Indigenous communities, and poor communities. And sometimes Indigenous peoples are all three. And so the Indigenous communities in the urban spaces are affected most, but really the real epidemic of this pandemic has been mental health. The situations involving overdoses, situations involving the lack of resources, and of course, the situation involving racism of Indigenous peoples in the healthcare system has resulted in a huge pandemic or an epidemic of violence in Indigenous communities, often in suicides, or as we saw in Quebec, deaths when you enter into a health facility.
I want to ask then, and this is a question, I mean, it's a question we ask every week, and it's a second, but the biggest question, that is, what are you watching for then in your different venues and in your different responsibilities? What are you watching for as the biggest challenges as we enter this next week of the pandemic? I'll start with you, Robert.
Well, I'm watching for the pressure that is building on the government to shut down the economy again, and they really don't want to do that because the mental health toll that takes, not just the economic toll of shutting businesses down and people being out of work, but the mental health aspect of not seeing people and not seeing friends and not being able to socialize, even, safely with social distancing. That's something I'm going to be watching for. I'm also going to be watching for this continued kind of evolution of a plan. I mean, in Ontario, they seemed on top of things in sort of late July, early August, and it's just been kind of, I don't want to say downhill from there, but it's certainly been evolving in a way that is not necessarily good for the government or necessarily good for the people. And I think everyone shares these concerns. This is not a particularly partisan thing, a partisan time in the sense that, Stephen Del Duca, the Liberal leader here in Ontario, was saying today, encouraging the Premier to shut down the economy. The Premier, ironically, is hearing from his own caucus members, some more on the right in the Conservative caucus at Queen's Park, who don't want him to even do what he's doing right now with mandatory masks and so on. So there's a really delicate balance for these guys, and the pulling and pushing is tricky.
Marieke, you kind of referred to it on the federal level in the sense that it's a federal government searching for a way to find out how they can help. I mean, the pressure, for example, on testing in the throne speech, there was a commitment to, we will be there to backstop you on X, Y, and Z, and yet the crisis continues to build. What are you watching for?
Well, I think we have to see how those promises, like the rapid response team that the federal government promised in these kinds of situations that we're seeing in Ottawa and in Toronto, when Ontario has 92,000 cases in backlog to be tested. Those kinds of questions. Okay, so Ottawa has promised these response teams. How does that actually work in practice? Will it work in practice? So that's one thing. The other thing is how Ottawa and the premiers continue to work together, because I think we saw after the throne speech some shakiness on that front. There was, a truce for quite some time between the mostly conservative premiers and the Liberal government here in Ottawa, and that seems to be more on shaky ground, I think, as pressure mounts on all fronts. So I think that's another thing to look forward to. Really, though, for Ottawa, it's going to be the fiscal update. It's going to be what measures they actually put in place, what things they actually prioritize by amounts of money spent and by timelines, that we'll really see how they're planning this going forward. Okay,
just a last word too. We're almost out of time, but Niigaan, what would you be watching for in Manitoba?
Well, there's an ongoing struggle, of course, this gap that we've identified between the provinces and the federal government, and it came out in the throne speech. The throne speech was all about provincial jurisdiction, but really the federal government has no control over that. But what we're seeing that on the ground level is the stress on provincial services that disenfranchised communities who are most impacted by the pandemic are placing. That's on things like health services, that's on police, that's on social services, child welfare particularly. And so what you're seeing is this really burgeoning conflict in cities across the country between Black, Indigenous, poor communities and provincial services, local services, that is really resulting in a very difficult situation.
Okay, well, all three of you, I want to thank you very much. We'll keep in touch and we'll keep watching this. And obviously something that it's hard to change the subject and look at anything else these days. It's the one subject that dominates everything. Thanks, all three of you.
Thanks, Martin.
Well, that's all the time we have for this edition of Primetime Politics. I'm Martin Stringer. Thanks for watching, and be sure to tune in tomorrow for our live coverage here on CPAC of the Green Party of Canada's leadership announcement.